Driven by nicotine addiction, tobacco dependence is a chronic condition. The fact is, no amount of tobacco use is safe, and tobacco use treatment can take time, require support, and may include several attempts. But effective, evidence-based treatments are available to help patients seeking recovery. Let's explore a goal-directed way to effectively address tobacco use with patients, designed to meet their needs in terms of readiness to begin tobacco use treatment. These simple steps are suggested language and can easily be integrated into your routine clinical workflow and delivered by the entire team. The 5 A's are ask, advise, assess, assist, and arrange. Ask. Ask about tobacco use at every visit. Emphasis is on every. Be sure to implement a system in your clinic that ensures tobacco use status is obtained and recorded every time. It's as simple as, do you use tobacco products, such as cigarettes, vapes, or chew tobacco? If they respond with yes, continue to the next step. If they respond with no, check in on their history of use, and if they've recently been through tobacco use treatment, then congratulate them and ask them about their challenges, confidence, and need for support. If your patient has recently relapsed, provide encouragement and support for a continued quit attempt. Advise and assess. This is the next sequence. Advise your patients to seek tobacco use treatment and assess their willingness to do so. Advise. If your patient is still using tobacco, you should always advise them to seek tobacco treatment. It's an important motivator for patients. Use language that is non-judgmental, clear and concise, and personalized to the individual. Something like, quitting tobacco is the single most important thing you can do for your health. I strongly encourage you to explore treatment options, and I'd like to help you with that. Are you interested? And be ready for some ambivalence. Assess. If your patient is more than willing, evaluate their thoughts about treatment and what they're wanting as far as a recovery timeline. Is it 30 days? 6 months? This will allow you to personalize resources and recommendations to your patient, while also showing them you're genuinely supporting their decision. If your patient is not ready for tobacco treatment, help motivate the individual by providing reasons for breaking the tobacco addiction, building confidence to make the choice, and leaving the door open to future conversations. Because of the effects of tobacco use on your health, I will continue to encourage you to quit. However, I understand that can be difficult, but I believe you can achieve it. I'm here to support you, and we'll check in with you the next time I see you. Assist. If your patient is ready for tobacco use treatment, assist with developing a plan for recovery. Plans should vary depending on where your patient is in their willingness to stop. Tobacco use recovery plans should include tobacco use counseling, a discussion on tobacco recovery medications, if appropriate, and a referral for continuing support. During the tobacco use recovery discussion include a recovery start date, usually within 30 days, a review of past attempts, including counseling and medications used, a discussion of potential withdrawal symptoms such as anxiety, sleep problems, restlessness and hunger, and coping mechanisms such as exercise, consistent sleep schedules, and drinking lots of water. A discussion of potential triggers such as situations, things, and places, and coping strategies like avoiding tobacco use situations and places and getting rid of tobacco products like lighters. By talking through these items with your patient, you are giving them an outline of what to expect and how to handle any hurdles that come their way. All feedback should be relevant and personalized to the individual you are working with at that moment. If your patient is not medically contraindicated, you may want to discuss medications and nicotine replacement therapy, such as patches or gum. TennCare will cover most nicotine replacement therapy, and providers can bill for tobacco use treatment services. The last thing your patient's plan should include is resources for continuing support. Whether they are more than ready or trying again or have a low willingness to quit, providing support and resources is an important part of enhancing the probability of their success. The Tennessee Tobacco Quit Line is a free telephone and online coaching program available to your patients with an easy referral through the Fax to Assist program. There are also online services such as smokefree.gov and Become an X, which provides text support and social media interaction. Arrange, the fifth and final A. For the patient who has decided to quit, when they leave your office, arrange for a follow-up conversation. This can be an in-person visit or a telephone call and should take place within the first week of their recovery start date. During this conversation, you will encourage the individual, discuss any obstacles and how to overcome them, and congratulate those who have accomplished their goal. If your patient has not been successful during their latest attempt, remember that tobacco use is an addiction and provide support, motivation, and encouragement that your patient will overcome this hurdle in time. Next time a tobacco user is in your office, remember the 5 A's: ask, advise, assess, assist, and arrange to help guide the conversation of tobacco use, treatment, and recovery.